The topic gender-based violence has been in your ears for a very long time, and today we want to tackle one of the components of gender-based violence, that is sexual gender-based violence. And in this video we are going to talk about the do's and the don'ts when you have been raped or defiled. But before that, there are some important questions that I want to ask you so that we can keep this discussion alive. The very first question is that, do men get raped? Number 2, if a man is raped, or a woman has been raped, or a child has been raped or defiled, which one is more serious? Does dress code normally matter? What in Kenya we say, my dress, my choice. If those ladies who are exposing their thighs and their breast in terms of mode of dressing, if they are raped, do we blame them? I want you people to comment in this comment section so that this discussion to be alive and to stay with me until the end of this video. If you love this channel, kindly donate via PayPal. And to my loyal subscribers, thank you so much for being with me. And if you are new here, hit the notification bell written subscribe, turn it on for more videos like this that I may post. When an individual has been raped or defiled, it is very important that you report the matter to the relevant authority within 72 hours. This is very important. It will help us in this discussion. You can either report into the police station or see your doctor, clinical officer, or a nurse in any health facility near you. Now, we want to discuss the do's and the don'ts. What are you not supposed to do when you have been defiled or when you have been raped? Remember, rapes comes about when somebody has sexual intercourse with you without your consent. He has forced you in which manner he has used. And when there is no consent, then we term this as rape. In Kenyan's law, somebody who is under 18 does not give consent. So if sexual intercourse occurs with somebody who is under 18 years of age, then we call this defilement. So in this context, consent is very key with an adult who is over 18, and this one will be posing no problem only if sex occurs without consent. And is it true that there is rape in marriage? Put your comments down here so that this discussion can continue being live. Following you are expected not to do when you have been defiled or you have been raped. First of all, do not wash your clothes that occurred, that you are putting on during the incident. Do not wash them, do not throw them away, do not discard them, because this is very necessary for us as clinicians, and is also very necessary for even the police in doing their investigation. Instead, wrap them very well. You can put them in a lasso or even a very nice newspaper or even a carton, or you can put them in an envelope, those brown envelopes that can fit your clothes. But do not put them in a plastic container, because this might interfere with the evidence. Do not take shower or bathe or even pass stool or even pass urine. We recommend that if you are told you can be able to pass urine, pass it in a very clean container and take this container to the hospital. Even your stool, if you can be able to carry, there's no problem. We will continue examining, because we are looking for forensic evidence. We are busy with the samples of that stool. We are busy with the samples of the urine. If you bathe, you will interfere with any fluid, even seminal fluids, the ejaculations that occurred in your body or in your vagina. We are very, very keen to take the samples of your stool or your urine, and even the secretions that have occurred anywhere. There are people who are being forced to even perform the oral sex. We are busy with collecting the semen samples in your mouth or even your anus. We are busy with collecting those samples. That's why you should never bathe or go to for a long call, and also even pass urine. Do not change anything where rape has occurred or where defilement has occurred, because of what we call local exchange principles, which I want to tell you here in reference to the trainer's manual or reference to this particular book, which is very, very important. We must understand what this local exchange principle is all about. Now, local exchange principle states that it is impossible for a crime to act, especially considering the intensity of a crime, without leaving traces of this presence. And this principle is often simplified as every contact leaves a trace. Every contact leaves a trace. And that's why there's also an individual apart from the Lockhart who came up with a new version. This guy is called Paul Kick, and he said that wherever he steps, whatever he touches, whatever he leaves, even unconsciously, will serve a silent witness against him. Not only his fingerprints or his footstep, but his hair, the fiber from his clothes, the glass he breaks, the tool marks he leaves, the paint he scratches, the blood or semen he deposits or collect. All these and more bear mute witness against him. That is Paul Crick from this Trainer's Manual Forensic Module Management in Sexual Gender-Based Violence Care. Now, in relation to the Lockhart's principle and Paul Crick, you are not supposed to change anything in the site of the crime. This will really help the police in doing their investigation. So the problem with us Kenyans is that if something occurs, everybody is stepping in. They want to see what happened, and this normally interferes with the evidence. What are you supposed to do? The do's. You are supposed to report as early as possible. The earlier, the better, but not later than 72 hours of the occurrence of rape or defilement. And we encourage that before even you go to police station, you should be arriving at the doctor's or clinical officer or the nurse desk, so that we can be able to examine and help you very, very fast before the evidence disappears. So when you report to us as clinicians in the hospital, there are very many things that we are going to do to you. First of all, we are going to take history and physical exam to ascertain the problem that you came with. And again, we will be able to offer you psychological support and even refer you where appropriate. In relation to the psychological support, we'll do mental assessment or psychological assessment as to ascertain what happened to you and to relieve you from the psychological torture, the psychological trauma, and to support you where necessary. We'll also provide you with drugs against HIV, that is PEP, post-exposure prophylaxis, and we will give you according to your age and according to your weight. We'll help you in relation to stop you from even getting pregnant by providing what we call emergency contraceptives. So in this scenario, we will help you again by filling the necessary document that is required by the court of law. We will help you to fill the P3 forms. We will help you to fill the post-rep care form, and also in the facility we will be able to insert your details in GBV register, and this one will also help us in doing follow-up, and also we will offer you psychological support. And we are very happy. For example, in Homa Bay County Referral, we have a rescue center that will refer you to, and there are trained colleagues that will help you to do away with this psychological trauma. They will continue giving you counseling until you will be able to get your justice. Of course, police and the judiciary will also do their part in terms of investigations, in terms of tracking the perpetrator and bringing the perpetrator to book. It's a challenge to all of us to make sure that we practice right from community level, and we want the community health volunteers, the CHVs, to be very active in referring the cases of defilement or the cases of rape to the health facility, and also the village elders, the chiefs and the assistant chief to take part in fighting against gender-based violence. In conclusion, I would like to thank all those who have been participating in GBV cases, and also to thank LVCT, the KOTUT team, for having trained very many people in fighting against gender-based violence. Also, my gratitude goes to the county government of Homa Bay for forming the rescue center and enable us to fight this gender-based violence. Not forgetting the Nairobi Women in the National Reproductive Health and Maternal Health Department. Otherwise, if you love this video, hit the notification bell, written subscribe, turn it on for more videos that I will post. Muchas gracias. Kindly report any forms of gender-based violence to these numbers on the screen. Kindly report any forms of gender-based violence to these numbers on the screen. Kindly report any forms of gender-based violence